Hi, my name is Michelle Yan, and today I'm going to discuss a little bit about the difficulty of balancing profit and social responsibility as corporations become large entities integrated into our society. How can the goal of balancing profit and increasing that profit go hand in hand with that social responsibility when sometimes that responsibility becomes multi-layered and confusing? As we've learned, the goal of a business is to earn a profit while maintaining that social responsibility. But sometimes responsibility is not always clear cut into nice sections and separated into clear levels and understanding within society. Of course, the base of a corporation typically involves that economic responsibility as the key component. That's what keeps that business going. That's what's going to move it into the future. And that's what's going to possibly even help some of these responsibilities with the society that it's serving. With some corporations, those legal responsibilities become quite burdensome. And when it goes hand in hand as the business serves a social need within the community, those ethical responsibilities are the service. So it can become the quality that drives that economic responsibility. So it becomes multi-layered and dimensional and reciprocal on many levels. So it's not always as nice as a pyramidal shape to be able to figure out how to move forward with those ethical decisions. What happens when a company is a key player in our social network? When a company becomes completely integrated into society and starts shaping the components, that clear line of customer and company and that who is driving that product becomes quite convoluted and dynamic. For instance, 74% of the worldwide deaths come from chronic diseases. It's pretty significant. How are the insurance companies driving change? Well, they're incentivizing prevention and health education and attempting to shape those cultural habits. Educational, they're out there teaching society and making it more difficult to get certain things and incentivizing the way they would like for their habits to develop. So they're really concentrating and changing habits within our society to move things forward. As other techniques and technology increases from other companies and our societal understanding of what technology can bring to our culture, that's immediately desired. So if it's going to help someone and benefit diagnostic testings and everything else, they are going to want access to it. Our community, if they know that something exists that can help them, and or the medical community understands that now we have the technology to understand a certain illness or disease, they're going to want to initiate that. They're going to want that put into action to better care for their patients, and the patients are certainly going to feel empowered to demand that if a technology exists that could help them, why can't they have it? Well, the balancing of the cost falls on that insurance company's lap, and that's quite a dilemma when now it's going to cost significant amounts, and the old treatments could still be very effective for most cases, but the statistical and aspects of that new technology benefiting, and even though everybody's wanting it, how do they say no in a nice way, or maybe this isn't necessary? So that does become a clashing situation with their customer base. Same goes for pharmaceutical increases. So as these pharmaceutical companies increase their understanding of and development of treatments, it's going to also be available, and that same dynamic is going to occur where, well, if we have something available that can help somebody, why can't we get it to them? Why can't we increase their quality of life? Same as the patients wanting, why can't I have it if it exists, if we know we have it? But it comes at a cost, and who is going to pick up that bill? And that's another thing that creates that ethical dilemma of how do we weigh that economic responsibility with those ethical dynamics. And what has come into the news lately, and the dynamic that's really creating quite a bit of emotional tension in our society right now, is that who's actually running the medical field? Who's driving our medical? Is it the patient and the doctor, or is it the patient and the insurance company, or is it this trifecta where the doctors do seem to become more and more upset with the insurance companies needing these pre-authorizations, questioning their judgment on the diagnostic tests or decisions on what procedures to do with their patient? It's really becoming quite an increased situation that is definitely coming more and more into the news and the media as something that needs to be solved. Corporations' ethical responsibility doesn't just lie with the social responsibilities of the society it functions in and the customer base, but also how it treats its employees. And it goes hand in hand with that economic responsibility. So if the corporation is unable to maintain its employee base, then the economic responsibility is affected greatly as well. So one thing that we've learned is that not only is wage and compensation a key driver with employment happiness, but also these hygiene factors that really affect how an employee feels in that environment and makes them there. Those ethical aspects of working for that company is one of those key drivers of keeping those employees happy. And you'll have a hierarchy of those needs that the employee is expecting. And one of those key components of those hygiene factors are those working conditions. It must be safe for an employee to be there. It must feel that they are connected to that agency, that corporation, that business, or there's a disconnect. And when you are a large corporation that is dealing within a society and integrated so much that the media is influencing a lot of the communication in our dynamic in our society, your employees, the company's employees, are subject to that same media, and you have to be more connected to your employee base than that media that is easily accessible. And that becomes more and more difficult as the corporation gets larger and larger, and you have extreme amount of employees scattered throughout the country. How are you going to reach all of those employees in such a personal way to keep them connected with your vision and understand that the corporation is ethical and is moving in the right reasons and the right purposes to keep those hygiene factors and those employees engaged for the right purposes? One insurance company that has been in the news quite a bit lately due to a dramatic event is United Health Group. In the Wall Street Journal article, even for an executive used to crisis, Andrew Whitty is being tested at United Health. This is an executive that is facing multi-layered ethical issues because of the size of the agency, the corporation, the amount of employees, the amount of media, and the tension that has developed because of the understanding of the control that they have in the medical field and a patient's life. Now, the dramatic event is not mentioned other than historical purposes in this article, but it did bring out the fact that a lot of our society is voicing that there's maybe some breakdown in how the future of healthcare is moving, and some breakdown in who is in charge of the healthcare in our society, and how can we streamline this and make this more effective. This article dives into Andrew Witty's situation specifically at his corporation in the form of the issues and how he is raising the profit. He is set to increase financial profits throughout this year, but his employees are starting to feel less and less connected to his vision, even while he is taking steps to be more forward-facing and maintaining this communication to a higher degree in his corporation. The article really dives into some of Andrew Witty's history, who he is as a person, where he came from, his background, the fact that he was knighted and he was in pharmaceuticals prior to taking over United Health Group. He has built it and has grown it significantly in his tenure as the executive. But this struggles is one that is more of an extreme than he's used to, even though he is not a stranger to crisis, as the article brings up several other aspects that he's had to deal with in other corporations that he has run. It really focuses in on the dilemma of healthcare in general, the pre-authorization issues and stresses that the culture and the company are facing, and who's kind of in charge, highlighting the fact that the medical community says that even though he has made movements and motions to decrease pre-authorizations, they feel that it is not truly intentional, that to better the situation, that it's more political for public facing. So he has some trust issues that he has to overcome within society. Then that goes hand in hand with the high level media that his employees are seeing regularly. And it seems from this article, while it doesn't go extreme in depth as in statistics of employee base satisfaction, but it does go into a couple of employees' statements that seem to indicate that even though he is in the office and he is sending out regular videos to interact with the employee base, that it's really not hitting home for all of the employees. They do feel that it may be more of a show rather than a true desire for moving in an ethical way in society and in the business. So that is one of those hygiene factors that are coming in play for those ethical decisions with his employees, and the ethical decisions within how they provide their service and how it is meeting the needs of his clientele. The fact that he has 440,000 employees scattered throughout United States, it makes that dynamic very difficult, as well as healthcare in general is not one person's problem, or didn't develop overnight by one agency or corporation. It's something more dynamic, and this article does focus in on the fact that even though hospitals and insurance companies and these mergers have developed these huge companies, we are seeing more and more of that separation and that division in the industry altogether. So there is potentially a future shift in the medical and healthcare and how insurances are going to interact with that community. But for this article, it does really focus in on those ethical decisions and raises the idea of what we are focusing on in our studies, that how can a business that is meant to make profit but is so integrated into society in such an ethical, emotional tie to our society, that dynamic and how it's balancing can be quite difficult. This slide brings together everything that we've talked about to this point, with the issues that Andrew Witte is facing, those social dilemmas, the fact that there are complaints about the bureaucracies built into his service, into the corporation of the service that he's providing, satisfaction aspects to the customers and the providers of the services, and his safety of his employees are a major ethical concern that he needs to work on, and has been working on. United Health Group has put into effect many policies that increase the safety of employees, due to the fact that much of the media has caused increased social interaction where the employees are targeted, have been receiving death threats, and it has changed and shifted a lot of the corporate's policies, because one of the key hierarchy of needs is safety within your working environment. So that's one thing that they are addressing in a pretty heavy-handed way to make sure that that hygiene factor is in place for their employees. So in closing, the struggles of large corporations intertwined with that society, it's not always about the profit. It's not just about the profits. It is definitely intertwined with those ethical responsibilities. And where this particular agency or corporation is going to go with those responsibilities, we'll wait and see.